Aloha, and welcome to this presentation of the Vegan Society of Hawaii. We're really happy today to welcome Dr. Peter Rogers. Peter Rogers, MD, is also known as a Spartan Vegan. Aloha, Dr. Rogers.
Hi. I'm going to talk about a strategy for how does a person sort of fight back against cancer. And I'm going to base it on my experience when I went to Stanford University. I was recruited there mostly as an athlete, not as a student. And I was real scared I'm going to flunk out, and I had injuries. I didn't know how well I would do as a wrestler. And these are my two coaches that really helped me a lot. They're brothers. This is Dave Schultz and Mark Schultz. And what I'm going to talk about, I call it the poor man's strategy to fight cancer. I'll also call it the Fabian strategy. I'll show you in a moment what Fabian means. You can also call it the scorched earth strategy. This is at Stanford University. These are the foothills of Palo Alto. There's the Hoover Monument, the Stanford classic red roofs and the sandstone buildings. Okay, and what I noticed at practice was, you don't see it so well in this shirt, but he was kind of fat. We ran sprints as a team, and he was kind of slow. And then we went in the weight room to lift, do squats, bench press, and all that stuff, and he was kind of weak. And I'm like, how did this guy get to be national champion? He's fat, weak, and slow. And I learned a really interesting strategy from him. I'm going to call it incrementalism, which means to basically learn every little detail you can about your field, way beyond what other people do. And that leads to excellence. So sort of the question one can ask is, how do you win the game when you have no money? How do you win when you don't have much talent? Because he didn't really have much talent physically compared to the other guys that wrestle. Yet he became a national champion, a world champion, and an Olympic champion. From him, I learned intensity way beyond like regular intensity. Okay. He would not speak to anybody 2 weeks before a big tournament to sort of focus his energy. And it was an incredible thing. So what I'm saying here is a willingness to learn is a great talent, and learning a bunch of small skills that can add up. That is also great talent. And anybody who motivates himself is capable of doing this. So Dave Schultz's strategy right here, Olympic champion, was incrementalism. He learned everything you could learn about wrestling. He knew 100 times more than a regular college wrestling coach. And then him, it was intensity of purpose. He's like, you have to focus all your energy on becoming a wrestler, because I had a little bit of difficulty my sophomore year. I had recurrent injuries. I wanted to spend more time studying. He got me motivated to only focus on wrestling. I did way better. By the way, this is Mark Schultz winning the NCAA championship against the Iowa guy, Ed Bannock. This is one of the best NCAA wrestling matches ever in the history of wrestling. Everyone thought Iowa guy was going to win. Here's Dave Schultz representing the United States. You can see he's got a pudgy little belly there. Usually most national champion, Olympic champion wrestlers are totally muscle bound. They got muscles on their muscles. He became known as the greatest technical wrestler in the history of the United States. Sort of like what Bruce Lee is to martial arts. That's what he was to wrestling. When he was a kid, he was a fat kid with dyslexia, and he got mocked. He said, oh, you're stupid. You can't even read. And he loved wrestling. And then he would ride his bicycle from the junior high team to the Stanford University, the Palo Alto High School, Pali High, and then to Stanford to practice with them. By the time he was a senior in high school, he was the best wrestler in the history of high school ever in the United States. He pinned the Iowa defending national champion, Chuck Yagla. Okay, so it was really valuable to learn from him. I learned more from him than any Stanford professor. Here he is winning the Olympics. So the point is, let's say he's in on a single leg. You ask a college coach, how do you finish a single leg? They're going to say you can do a dump, run the pipe, or you can take it up high, treetop. He would have 20 other things you could do. And then here's the counter, to the counter, the counter, the counter. So the point I'm making is most cancer patients don't know much about cancer, and it's worth their while to learn about it. For example, here's a quote from Chris Wark. He says, to just go for surgery and chemo is easy. You just sign the consent form. It's passive. But to really study cancer, to completely change your diet, your exercise, your habits, your attitude towards life, that is difficult. It takes a lot of effort. It's an active process. And I think that's a great quote from Chris Wark. He wrote Chris Beat Cancer. He's a long-term survivor of colon cancer. And a little bit of what I'm talking about is you want to be like, this is the Indian proverb of 5 blind men or 6 blind men and an elephant. So the first person comes along, feels the tail, and says, oh, it's a rope. The next guy comes along, feels the side, says it's a wall. One guy feels the leg, says it's a tree. And the point is, you want to have absorbed multiple perspectives on your problem so you thoroughly understand it. And once you have that going for you, you can make a wise decision about what to do rather than just impulsively leap into something you might regret later. Aristotle, the Greek philosopher, had said, the first step to an intelligent conversation is to remove emotions. And the typical patient gets all emotional. I've got cancer. Oh my God, I don't want this. Cut it out. I want surgery. And don't get me wrong. Sometimes surgery is a good treatment. Sometimes surgery is part of multiple other treatments, but you don't always rush into surgery. You got to know what you're dealing with first. I've seen lots of people regret having surgery, especially for prostate cancer. So trust me, I've dealt with thousands and thousands of cancers. You want to know what you're dealing with before you decide exactly what you're going to do. Okay, briefly, what's the Fabian strategy? The Fabian strategy comes from the Punic Wars of Carthage against Rome. Hannibal was the leader of Carthage, and he was an incredible general. He destroyed Rome in battle after battle, killing many, many tens of thousands of Romans, and they were very frightened of him. In an open battle, the Romans could not fight Hannibal. But then they had a wise man named Quintus Fabius Maximus. He says, I know how we could beat Hannibal. And he was going to use what is called, it became called the Fabian strategy, to simply take the resources away from Hannibal. Hannibal was far away from Carthage in Italy, in Rome, around Rome. So what they did was they just diminished his supply line so his soldiers wouldn't have anything to eat. And that's basically what you do to cancer. And it's reminiscent also, of course, what happened with Napoleon. Everyone was terrified of Napoleon. He comes up over the Alps. Nobody could beat Napoleon head to head. But when he went into Russia, what they did was Napoleon always said, an army marches on its stomach, okay? And cancer grows on its stomach, so to speak, as well. And he would just take all the food from all the peasants anywhere he would go. So what they did was they just had all the peasants hide their food or burn their crops. And then Napoleon had no food. And he came in with 500,000 men. He retreated with 15,000, and he had to leave Russia. So basically, that's the kind of thing you want to do to cancer. All right, so here's the three big phases of cancer. There's initiation, which is the DNA damage. And now, most of the books are going to talk about what's called the SMT, somatic mutation theory. And all of us have had some DNA damage when we were younger. Who knows? You can't remember, from a mutagenic chemical or a virus or whatever. But I think it's much more important to understand that the metabolic theory of cancer is a lot more helpful. I actually believe that the somatic mutation theory has largely been disproven based on the Genome Atlas project and a whole bunch of other stuff, and the research of Seyfried and others. But the hypoxia theory, or the metabolic theory of cancer, this goes back to Otto Warburg in 1931. He won the Nobel Prize. The gist of it being is you put cells in a tissue culture environment. Once you make them hypoxic, quite often, a lot of them will die from the hypoxia, lack of oxygen, but some will transform into cancer. Okay, so we're going to get into this in more detail, but just be aware of that. The metabolic theory of cancer is very useful, okay? We're going to come back to that. Okay, now here's where the battle is really fought primarily, at the tumor promoters. There's a bunch of things that make cancer grow. So you, as a cancer patient, want to avoid the things that make cancer grow. Animal protein in particular. T. Colin Campbell, who wrote the China study, says that animal protein is the most powerful tumor promoter, cancer promoter. Promoter means to make cancer grow. And the reason is the amino acid composition of animal protein is quite different than is plant protein. Animal protein has far more leucine, more methionine. It also leads to, in the process, the amino acids like leucine. Well, leucine activates mTOR, which is a nutrient sensing pathway, like a contractor getting ready to build a building. And it has to have all the building materials available before it can build. And leucine is the rate limiting step. Once it has leucine, it says build, which means it tells the cell to replicate. And leucine is much more common in meat. Okay. There's other things that happen. Well, I'm going to explain those in a moment. The other thing that's particularly relevant for breast cancer and prostate cancer are estrogenic chemicals. Okay. So you want to avoid the estrogenic chemicals in the environment. We're going to talk about how to do that. Iron in general is carcinogenic when it's present in excessive amounts, and it very commonly is in men after 20 years of age, and women once they're postmenopausal, okay, because of sort of a westernized diet, it's very high in iron, and even more so since 1979 when they fortified most of the grains and cereals with iron. Okay, things that cause insulin resistance, like a high-fat diet, they're also going to activate mTOR. They're going to increase insulin-like growth factor. So you need your immune system. We'll talk about that in a moment, but anything that's bad for your immune system weakens your ability to fight cancer. Now, in terms of fighting metastasis, we talked about maintaining the lining of the arterial cells, the endothelium, the glycocalyx. So we'll talk more about that. We're also going to talk about the tumor milieu, trying to prevent lactic acid accumulation, because an acidotic hypoxic surrounding of a tumor favors cancer. And psychological stress makes things worse too. We'll talk about that in just a moment. We're going to go through a little bit of basic science here. Prokaryote. Pro means before. Karyote means nut in Greek. And that really refers to having a nucleus. So a bacteria has no nucleus. It's a prokaryote. A eukaryote, which is all the cells in humans, have a nucleus. And so eu means true in Greek, karyote, nut. So true nut means true nucleus. But here's the big secret. The nucleus is not that important. It's not that important in cancer. What's important mostly is the mitochondria. And the metabolic theory of cancer will explain that. So that's important to know. We're going to talk more about this mitochondria here. This is its outer membrane. This is its inner membrane. And this is the space between the outer and the inner membrane, the intermembranous space. Inside of it is the matrix. That's all going to be relevant. We'll come back to it in a moment. Okay, here's a better picture of it. Outer mitochondrial membrane, you'll see that as OMM. The inner mitochondrial membrane, you'll see that abbreviated IMM. And then the center of it is called the matrix, mitochondrial matrix. Okay, and then the space in between the inner and outer membrane is called the IMS, intermembranous space. This is how almost all energy is produced in humans. So this ends up being highly relevant to lots of diseases. Okay, so here's a picture of an inner mitochondria close up from a side view. And here's the outer mitochondrial membrane, OMM. Here's the inner mitochondrial membrane. Electrons are passed through these electron carriers, which is kind of like a fireman bucket brigade. And they got to pass these electrons on down to oxygen. As it's passed down from carrier to carrier, each protein complex has a stronger affinity to want to grab electrons. And the most powerful grabber of electrons is oxygen because it has a very high electronegativity. You can look that up in a periodic table of elements. That means a desire to grab electrons. Oxygen wants electrons. You need oxygen to run this energy producing pathway. Protons are pumped into the intermembranous space and it creates a pressure gradient. It's kind of like an air pump under pressure. And that pressure is harvested by letting the proton come back into the mitochondrial matrix. And then you can make an ATP, adenosine triphosphate, which is the energy currency of the cell. This is a $20 bill in a cell. It makes things happen. Every once in a while, you'll leak an electron down to oxygen and you'll produce a free radical called superoxide. But the mitochondria has ways to neutralize that. Normally, the body handles all this stuff just fine. This is just a little bit more detailed diagram of the electrons being passed down through these carriers until they reach oxygen. Okay, that's actually going to be real important. Oxygen makes it all happen. Without oxygen, you cannot run these pathways and everything shuts down. And now here's the difference between a normal cell and a cancer cell. A normal cell is a worker. A normal cell is like a galley slave, okay? Its job is to just work all day long. And to work all day long, it needs a lot of energy. So a normal cell focuses on making ATP using oxygen in the mitochondria like we just showed. That's what it does. Imagine you're a liver cell. A liver cell has to detoxify all the chemicals in the blood. It has to maintain a blood glucose level. It has to also produce the bile for digestion. So it's doing tons of work, the individual cell. Cancer is different. In cancer, the mitochondria is typically damaged and it can no longer produce that much energy. So what happens to the cancer cell, it almost like turns into a bacteria. And it sort of says, you know what? I cannot work, let's say, as a liver cell. I don't have enough energy to do it. You know, take this job and shove it, like the Johnny Paycheck song. And what the cancer cell wants to do is it says, I'm just going to find a new apartment. I'm moving out. It just wants to replicate itself, make copies of itself and send them into the blood so they can, you know, find a new home somewhere else and grow. So what the cancer cell needs to do is in order to double oneself, to replicate, the cancer cell has to double itself. So it has to make copies of everything, all its proteins, its membranes. So it focuses on synthesis, biosynthesis. That's why it needs tons and tons of glucose. Also, by not running the mitochondria, you can produce a little bit of ATP through anaerobic glycolysis, but it's not that efficient. Using the mitochondria produces 18 times as much energy. And so because it has to run these sort of primitive pathways of an anaerobic bacteria, cancer cells need tons of glucose, like 100 times more glucose than does a regular cell. That's why you see a positive PET scan. PET scan is a nuclear magnetic study for imaging cancer where you can detect it by its increased uptake of glucose. All right, now here's the main mutation that one sees with hexokinase. Hexokinase is the first enzyme in the glycolysis pathway. And instead of being hexokinase 1, you'll get hexokinase 2 in cancer patients, and it attaches to the mitochondria, and it actually prevents the cell from undergoing apoptosis. The relevance is cancer is most commonly initiated by a lack of oxygen to a cell. And most cells, when they have a lack of oxygen, they die. But a cancer cell is unique in that instead of dying, it simply transforms itself into like a primitive anaerobic bacteria. And the way it stabilizes the mitochondria, instead of the mitochondria dying, it stabilizes it by hexokinase 2 attaches to it. That ends up being the most important mutation in all of cancer. And it's really more than, I wouldn't call it a mutation. I would call it a change in approach to life. when there's lack of oxygen, hypoxia, a cell can either decide, is it going to die? Apoptosis means to die gradually and let yourself be recycled. And that's what most often happens with hypoxia. But a cancer cell says, no, I'm just going to grow and move somewhere else. This is transformation into cancer. This is a metabolic theory of cancer right here, transforming oneself into an anaerobic bacteria, essentially. And then cancer, like bacteria, is kind of stupid. It just tries to replicate itself as fast as it can, and then it'll often run out of resources and die. And that's pretty much what cancer does. It grows all over the place, kills the patient, and dies. Now, this is one of the most important slides in the whole picture. So it comes from this paper, Quantitative Cell Shedding in Breast Cancer, Mammary Adenocarcinoma. And the point was that a 1 gram tumor, by the way, this is like a grape, a purple grape here, is about 5 grams in size. But a tumor as small as 1 gram, so 1/5 this size, can shed over 1 million cancer cells in the blood every day. And the point of this slide is that the immune system is needed to remove the cancer cells. So you want to have a healthy immune system. I tell you, this is one of the most important things you can understand. And a lot of doctors don't know this. You need your immune system to function to remove these metastatic cancer cells. That's their job. And I also showed you earlier that having an intact glycocalyx helps prevent those cancer cells from being able to anchor onto your tissues. Now, here's a slide that comes largely from a talk by Dr. McDougall, and it's with regard to how cancers replicate. On average, a cancer doubles itself once every, about 100 days, okay? So it'll go from 1 cell to 2 cells to 4 cells to 8 cells to 16. All right, approximately each 100 days. We usually cannot find a cancer until it's about 1 centimeter in size. So a centimeter, what is that? It's about the size of your thumbnail, for example. By the time we can see a cancer and be sure it's a cancer, we can see a smaller lung nodule on a CAT scan, for example, and you'll sometimes see smaller things on a mammogram, for example, but most often you're going to get close to 1 centimeter before you can confidently identify cancer. It depends on the context, whether or not there's adjacent things that hide it and whatnot. But the point I'm making is most of the time before we can confidently detect a cancer, it's already metastasized. So it is already spread somewhere else in the body. And when you can't see those on a CAT scan or a PET scan, those are called micrometastases. And the relevance is it's usually not the primary tumor that kills the patient. No, a woman doesn't die because she's got a tumor in her breast. A man doesn't die because he has a tumor in his prostate. They die because the tumor spreads to other locations and causes damage. They die if they get brain metastases because you need your brain to survive. They die if they fill up your liver with tumor and you no longer have liver function. You die if it obstructs your bowel in a way that you can't be fed adequately. So there's things like that can happen. So the point I'm trying to make is most people, by the time they're diagnosed officially with a cancer, they've got micrometastatic disease and they need their immune system to help them remove those tumors and to prevent additional ones from growing. That's a key point. That's an essential point to get that. Okay, this comes from the work of Thomas Seyfried. He wrote a book called Cancer is a Metabolic Disease. And the point of his research here was that here's a normal cell dividing. It has DNA, and everybody thinks of DNA and the nucleus being the most important thing, and the cell divides, makes a copy of itself. That's normal dividing cell. Okay, here's a cancer cell dividing. I made everything in red with the cancer cell. But here's where it gets interesting. If you have a normal mitochondria and cytoplasm and you transplant the cancer nucleus into that cell, these are called cybrids, meaning cell hybrids, this cell will not be cancerous. It will grow normally. So the point I'm making is the DNA in the nucleus, that's not what's driving the cancer. If, on the other hand, you transplant the cytoplasm into another cell, but you keep normal DNA, that cell will turn into cancer. But the point I'm making is what's driving the cancer is coming from the mitochondria and the cytoplasm. It is not coming from the DNA. And this is an additional confirmation of the metabolic theory of cancer rather than the old-fashioned somatic mutation theory. And that's a key point because metabolic theory of cancer, it actually empowers the individual to realize there's a lot of things they can do to improve their metabolism. Okay, another key point to understand about cancer is there's 3 basic categories of cancer. This comes from George Cryle, MD, and Gilbert Welch. So he was over at the Cleveland Clinic, George Cryle. And what he basically said is cancer tends to fall into 3 categories. When a person hears the word cancer, what they usually think of is a rabbit. And let me explain what this drawing means. Imagine you're a farmer and you have this giant plot of land, let's say, 100 miles of farmland. And right in the center, you have a fenced-in enclosure and you got a rabbit in there. You've got a vulture in there. Well, if one of these animals breaks out of the enclosure, if it's a vulture, for example, there's nothing you could do. The vulture will fly over the fence, 10 miles, 20 miles, however big the farm is, and it's gone. There's nothing you can do. The patient will die. But those are super rare, super, super rare. All right. The next thing, if it's a turtle, if the turtle digs under the enclosure fence here, you could go on vacation for 6 months before that turtle will get to the outer enclosure fence. So it's not going to kill the patient. They're going to die of something else. Now, the rabbit, again, is what we usually think of when we talk about cancer. The rabbit makes a run for the fence. You want to stop the rabbit, okay? And here's what most people don't know. Most cancer is turtles. And so you have to be careful with a turtle that you don't overtreat the turtle, because you might die from the treatment and suffer a lot of complications. So you want to try to figure out what you're dealing with. And this also brings up another issue. Should you screen for cancer? Should you do mammography? Should you check a PSA? And that's a whole other debate. I can just let you know, in general, I'm not a big fan of screening. And I have, I've got about 30 years experience with it. I think it's quite overrated. We don't have time to get into all the details of it. You'll find plenty of information on the internet. Dr. McDougall is a good source. Peter Gotchke is a good source. And there's other good sources. But I'm just letting you know, because patients tend to love screening. I think it's the greatest thing in the world. But they don't understand, if they have a turtle and they get overtreated for a turtle, they could have a lot of side effects from that. So you got to be careful. Okay, a little bit more on cancer physiology. We talked about an anaerobic bacteria. Anaerobic means without oxygen metabolism, which is very slow to produce ATPs. Then we talked about a normal cell, which makes tons of ATP. And now getting to the cancer cell, which is very much like the anaerobic cell. So here's some unique things about a cancer cell. First of all, it takes in a lot more fat because it has to rebuild all its membranes and double itself. And here's another thing most people don't know. Most doctors don't know this. You have a lot of iron receptors, or really transferrin receptors for the iron transporting protein in the blood. But they can have as much as 1,000 times more transferrin receptors on this plasma membrane. And that's why lowering one's iron level in the body storage level, for example, serum ferritin, is a way you can help prevent the cancer from growing. And this is how we prevent bacteria from growing in our body. We sequester iron. That's going to be a real important point. We're going to come back to that. The other thing to know is that glutamate, well, it comes in the form of glutamine initially through the blood, goes into the cell, and that can enter the mitochondrial matrix. And you can run Krebs cycle, the main mitochondrial cycle. You can run it in reverse off of glutamine. And the reason I show you that is because people tell you, oh, we're going to go on the ketogenic diet. We'll deprive the patient of glucose, and that'll slow the cancer from growing. And I'm telling you, I don't believe in that. I'm not optimistic about that at all, because I've studied the biochemistry of this pretty in great detail. And to me, it seems you're stuck with glutamine. You can't get around it. It's like the most abundant amino acid. It's coming to come in the back door, and the cancer cell can run everything off glutamine. So trying to lower your glucose level, I don't think it's going to work. Plus, your brain needs glucose. Another thing that's important to understand about cancer is that it pumps protons into the extracellular matrix, meaning the space around the cell, and that causes acidity. And so the space around the cancer cell is called the tumor milieu. It's like the French word. The relevance here is that the tumor milieu tends to be acidotic, a lot of protons. That's what acidity is, more protons. It tends to be acidotic with a lack of oxygen, hypoxic. So hypoxic, acidotic tumor milieu favors cancer, because cancer, in a sense, has to fight against the adjacent cells. And it does all kinds of things so that it can grow, and it'll suppress their growth. And when you sequester iron, you make it hard for that cancer cell to grow. When you don't give it excessive amounts of fat, you make it hard for that cancer cell to grow. When you avoid things that cause hypoxia, you help favor the normal cells. When you avoid things that cause acidosis, you help favor the normal cells. And, low-fat vegan diet of whole foods does all the things you want. And that's why I'm a big believer that's one of the best things you could do. A red blood cell has a negative charge along its outer layer. This is called a zeta potential. And that's a very good thing, because the negative charge on the outer surface of the red blood cell, it repels other red blood cells, so they bounce off each other. They don't stick together. It's caused by a couple things. It's caused by cholesterol sulfate. It's caused by sialic acids, which are negatively charged. It's like a glucose with a carboxylic acid on it. It also gets negative charge just from its glycoproteins, its sialic acids. Sialic acids, cholesterol sulfates, and just as glycocalyx. When you've got something that overcomes the glycocalyx, like here's an IgM antibody from an acute infection, it has positive charges on it, and it's big enough, it'll go in between these RBCs and it'll stick them together. There's other things that can do that. LDL cholesterol do that. That's why cholesterol is the main risk factor for atherosclerosis, because most people in Western countries eat a high-fat diet, high LDL cholesterol. It jumps in between these two RBCs and sticks them together. Uric acid can do that as well. Being stressed out, high fibrinogen will do that. Okay, so here's red blood cells that are stuck together. Here's the RBCs, red blood cells, and here's a bridging molecule, which again could be LDL cholesterol, it could be fibrinogen, it could be IgM antibodies. A typical red blood cell is about 7 microns in diameter, whereas a capillary is only about 5 microns. So what happens is the red blood cells have to deform themselves a little bit to get through the capillary. When they're all stuck together by the high cholesterol or the stressed out high fibrinogens, the uric acids, the acute infections with the IgMs, anything that's a bridging molecule, it's harder to push them through. So blood pressure has to go up to pump them through the capillaries. This drawing right here is what is laminar flow. Laminar flow is like your hand. Okay, and I put my thumb right there. In the middle is your red blood cells. It's the 2 red arrows. Adjacent to them is your white blood cells. And then right at the side here is the plasma, sort of a parabolic velocity profile. And that's normal blood flow. This is what your body wants. This is what you have at normal blood pressures. When you're hypertensive, this profile starts to become much higher in velocity and distorted, and it hits the median divider rather hard. This is a typical bifurcation point. This will be, for example, I'm drawing this because I usually am talking about the carotid artery going up to the brain, but this applies to every bifurcation in your body. The high blood pressure hits the median divider of tissue between the 2 branches of the blood vessels here rather hard, and it becomes quite turbulent, the blood flow, and then some of it will go retrograde. These are called retrograde eddy currents. And it confuses the lining cells because the lining cells sense the pressure. They sense the direction of flow. And when they have an excessive amount of turbulence or retrograde flow, they start to express prothrombotic molecules. They shed their surface upper coating, the glycocalyx. Glycocalyx is like trees on a hill. So they'll shed the treetops, if you will, and they got a bunch of adhesion molecules below that, and you'll form blood clots. Atherosclerosis is really a blood clot. I did a fellowship, by the way, in imaging-guided surgery at Harvard with the emphasis on vascular disease. So I can tell you, I've been involved in atherosclerosis for many years, and everybody thinks it's all cholesterol. It's actually something called atherothrombosis, and cholesterol is a subset of atherothrombosis because cholesterol causes red blood cells to stick together, in particular LDL cholesterol. And I look at CT angiograms every day. I can tell you, atherosclerosis is a blood clot that then organizes, and it contains cholesterol from the LDL, but that's actually a key point to understand if you're going to ever try to understand atherosclerosis. The thing to understand about the endothelium, the arterial lining cells, is that they make nitric oxide. So NO is nitric oxide, and it does 2 major things. Part of it goes deep into the arterial wall, and it relaxes the smooth muscle. So you get vasodilation. It opens up your arteries so you get more blood flow to the tissue. You want that because you need that for oxygen delivery. It also interacts with the platelets to prevent them from sticking together, to prevent them from clotting. Dr. Caldwell Esselstyn's real famous for his low-fat vegan diet, helping to reverse coronary artery disease and prevent coronary artery disease. And the key point is nitric oxide. There's a whole bunch of other things from the arterial lining that help prevent clotting, but the only thing we really need to know for our purposes is no nitric oxide. Okay, that's going to come up a lot. You need to know that. Here's just an atherosclerotic plaque in the wall of an artery, and it consists of several things. There's a lipid core coming from the plasma membrane of the red blood cells, coming from the cholesterol. And when you go low-fat vegan diet, that can be reabsorbed. There's the dead cells from the hypoxia and the inflammation, and that's called a necrotic core. Necrotic means dead cell, and that can be reabsorbed. So, I mean, that can all shrink back down. The acute clot of red cells and platelets, that can also be reabsorbed. The calcification that eventually occurs, they cannot reabsorb that. The fibrous tissue, if it's acellular, you can't reabsorb it, but in the early phase of fibrosis, you can partially reabsorb the cellular component of fibrosis. So the point of this is you can shrink an atherosclerotic plaque. In addition, these endothelial lining cells will start to make nitric oxide again once they're healthy. You're eating a low-fat vegan diet, and that will help to open up the artery and vasodilate it. The reason why vasodilating, open up the diameter of an artery, is so important is it means more blood flow, more oxygen delivery, which helps prevent cancer. Most of the time when we talk about atherosclerosis, we're talking about the context of a heart attack or a stroke, but it's also highly relevant to cancer. Get more oxygen to the tissues, that helps to prevent cancer from growing. When you eat a high-fat meal, the blood becomes thick. It becomes opaque. Normally, if you have your blood in a test tube, the red blood cells sediment at the bottom, the white blood cells in the middle, and the plasma up here, and you can see through it. When you've eaten a real high-fat meal, the plasma just gets thick and opaque, and you can't see through it too well at all. So you can visually see it. This guy, Peter Quo, was a cardiologist in Pennsylvania, and he took a bunch of patients. He checked their blood every 30 minutes for their lipid levels. And these are a bunch of patients with known coronary angina, chest pain on exertion. And what he found was when they ate a high-fat meal, let's say saturated fat, they would get peak angina about 5 hours postprandial after eating, and then it would taper off. And it totally correlated with the peak level of fat in their blood. And Ansel Keys figured out that saturated fat was a major atherosclerosis risk factor in the 1950s, but In the 1960s, there was an initial push for unsaturated fat, like the omega-6 cooking oils, for example. That sort of became popular. They thought maybe that would be better. But what was shown by the research of Peter Kuo, as well as Meyer Friedman and Ray Rosenman, was that these omega-6 unsaturated fat cooking oils, they were worse. They caused even more prolonged thickening of the blood with, anginal episodes, with occlusion of arteries. Whereas when you eat a carbohydrate meal, like a low-fat vegan meal, you don't get this lipemia at all. And you don't get the anginal, you don't have the same anginal risks. So it's very beneficial. This is the work of Roy Swank. Roy Swank was a neurologist from Canada initially, then he moved to Oregon, and he did great work on helping multiple sclerosis patients to avoid progression of their disease. These are the researchers I mentioned a moment ago, Meyer Friedman and Ray Rosenman. They did a lot of work in the eye. This work has been done in animals, in the cheek pouch of hamsters. It's been done underneath the tongue in humans, sublingual. It's been done in the eyes with an 80-fold microscope to look at. So anyways, here's the work of Roy Swank, and he showed when you eat a high-fat meal, the red blood cells all start sticking together, and that will cause tissue hypoxia. They can't deliver oxygen as well. At Dr. McDougall's YouTube channel, he's got a video of it. It's about 50 seconds long. It's worth seeing. Most people don't have any awareness of that. And it explains, too, why if you eat a real greasy meal, you feel sluggish afterwards. So what's the big deal about metabolic theory of cancer, MTC, metabolic theory of cancer? And this is called the Warburg effect. He was a German biochemist, again, Nobel Prize 1931, and he found that if you make cells hypoxic, they will transform into cancer. Chronic hypoxia, let's say of 35% or more oxygen, can cause cells to become cancerous. And a typical example is, let's say a person inhales asbestos particles. The body will form an inflammatory response to it, and it'll try to wall off the foreign body with fibrosis, scar tissue. Well, some normal lung cells will be trapped into the fibrosis, some cells of the pleura, the lung lining, and the scar tissue that forms around them, the collagen, will cause some of those cells to become hypoxic, having a lack of oxygen. Most of them will die, but if some of them live, the hypoxia can lead them to transform into behaving like an anaerobic bacteria and growing as a cancer. So I'm just showing you the mechanism of how the metabolic theory of cancer works. Okay, and the same thing in the liver. A lot of people have a fatty liver. The fatty liver, by the way, I see fatty liver all the time. If you tell me a patient has elevated LFTs, liver function tests, it's going to be a fatty liver 9 times out of 10 as a cause. Tons and tons of people who eat Western diets, they eventually all get this sort of stuff. There was a pathologist by the name of William C. Roberts, and he wrote that, what percentage of herbivore animals, humans have herbivore physiology, develop atherosclerosis if you feed them a high-fat diet? It's 100%. How soon they manifest with symptoms, that varies, but they all get atherosclerosis. I see fatty liver all day long, every day. It then starts becoming inflamed. So they'll call it, non-alcohol fatty liver, non-alcoholic steatohepatitis, and it gradually becomes scarred, fibrosed. And when that fibrosis is occurring, it will wall off segments of liver cells that will become hypoxic and transform into cancer potentially. This also happens with a virus. You could have a hepatitis C virus, for example, hepatitis B virus, causing scarring in the liver, tissue hypoxia, and some of those cells eventually transforming into liver cancer, hepatocellular cancer. I'm showing you how this metabolic theory of cancer works. So we want to avoid this to the extent we can. We want to maintain good oxygenation of our cells. We want to maintain a normal blood pH, some alkalinity, but the key thing is getting that oxygen there. So this is the book of Caldwell Esselstyn, Prevent and Reverse Heart Disease. On his long-term follow-up study, he had 198 patients in a row that followed this diet, not have any subsequent coronary events. They'd had previous coronary events. There's nothing else like that in medicine, by the way. And he's very logical. Esselstyn says, look, if you look around the world at populations that eat these old-fashioned, low-fat, plant-based diets, they don't get any atherosclerosis. Nitric oxide is the most powerful vasodilator in the human body. He describes it as being like a life jacket for your arteries. And he says the number one goal to have a healthy artery is to maintain nitric oxide production. And I would agree with this. I mean, this is an oversimplification, but it's what really matters. I actually was out at Cleveland Clinic and I was talking with him. I went to his whole day course and stuff. And I'm like, well, what about this? What about this? What about this? He goes, Pete, I just want people to understand nitric oxide, because if they understand nitric oxide, they'll do the right thing and they're going to be fine. If you talk about all the details, you confuse them and then they won't remember anything. Okay, so as people get older, their nitric oxide production decreases. And that's especially true if they're eating a westernized diet. It does happen in other persons too, even if they eat healthy, but not as much. And I say that also because if you have a population that eats a healthy diet, they'll have the same blood pressure in their 70s as they did when they were teenagers. But the point is, people still lose some no matter what as they get older. For the past 10 years, he didn't do this initially when he started back around 1985, but especially the last 5-10 years, he now has the patients who are especially high risk to eat vegetables like leafy greens 6 times a day, because he wants to keep the arteries bathed in nitric oxide. When you eat greens, I'll show it on the next slide how it works. You produce more nitric oxide that goes throughout your body, systemic, and helps keep your arteries open. Sunshine also produces systemic, it means total body increase in nitric oxide. Okay, so here's a picture of what happens. When you eat leafy greens, they contain nitrates. The nitrates are converted by tongue bacteria into nitrites. That's NO2. And then when it goes down into the stomach acid converts it into nitric oxide, and that's absorbed into your blood. It travels throughout your body, and it keeps your arteries dilated. So you want to avoid, I don't use toothpaste with F- in it. I don't use mouthwash, any of these stuff, because they can decrease your ability to generate nitric oxide from the greens that you eat. Also, if you have proton pump inhibitors, that'll block it as well, antacids and whatnot. So those are some things you'd want to avoid. But this is just one of the many benefits you get from eating plant foods. And by the way, I wasn't initially interested in vegan diet. I was a macho wrestler, tough guy, okay? And I thought vegan diet is stupid. It's something that a hippie or a pot smoker or something would do. I came to vegan diet reluctantly just because it works, okay? I had no philosophical issues. Okay, so the next thing is, here's tumor milieu, the space around the cancer. And within a cancer, you'll have areas of hypoxia, lack of oxygen. You're going to have acidosis in the periphery of it. So the tumor milieu is hypoxic and acidotic. Okay? Then you're also going to have something called cancer stem cells. And cancer stem cells are a big deal. They're less than 1% of the cells in the tumor, but the problem is they're very hard to treat. Chemotherapy especially works well on a cell that's dividing rapidly. Well, the cancer cells are often dividing really slowly. And they also sometimes will have extra plasma membrane pumps to pump out the chemo, if you will. So they are often quite resistant to chemotherapy. And this is why you'll sometimes give chemotherapy and you'll see the tumor shrink down a lot. But then on a follow-up study, another 6 months or a year later, the cancer will come back, it'll grow rapidly, and it'll spread and kill the patient. What I'm trying to say is, don't get me wrong, for some types of tumors, chemotherapy is more effective. It's great for testicular cancer. It's great for leukemias. It works reasonably well for small cell lung carcinoma and some other settings, okay? But people need to realize it doesn't work in a lot of other settings. And one of the big problems is this stem cell issue. So we talked about the low pH, the acidosis of the tumor milieu. Fruits and vegetables are alkaline, and they help promote an alkaline normal pH in the body. Just, mild chronic acidosis. You get that from meat because it has a lot of sulfur-containing amino acids like methionine and cysteine. Part of their metabolism, they get degraded into sulfuric acid in part. And that causes a low-grade metabolic acidosis. Same thing when you eat a lot of salt. The sodium chloride has these chloride ions, and when they're present in excess, they displace the bicarbonate ions in the blood, leading to a low-grade metabolic acidosis. These are things that just sort of favor the tumor milieu, so you don't want to do that. Okay, here's a picture of a book by Ruth Heydrich, and she's one of the world famous super survivors of cancer. She had breast cancer when she was about 42 years of age, and she went to Dr. McDougall. She went on a low-fat vegan diet. And by the way, I remember seeing one of her interviews. She said she just became a low-fat vegan after a 2-hour conversation with Dr. McDougall, because it's logical. You'll see, the more you study it, the more obvious it becomes. I've studied it for decades now. Here's another lady who did something similar. She's been alive for many decades and, won these world championship triathlons and whatnot and marathons. This lady is from Australia. Her name is Janet Murray Wakelin, and she did something similar. They both exercise, obviously, a ton. They both eat 100% plant-based diet. She actually ran in the periphery of Australia, 365 marathons. So I saw an interview of Ruth Heydrich where she goes, I train every day. And I thought to myself, oh, God, am I a wimp? I don't exercise every day. I better start exercising. I put her picture up on the wall in my bathroom. I put my heroes up on the wall in my bathroom, so I see them every day, and they motivate me that I got to exercise and do all the other things I'm supposed to do. But this is rather extraordinary. They're in their, they're over 60 years of age. They're running marathons and doing triathlons. Most people who don't have any medical known problem, they can't do that. So what I'm trying to say is you're going to be surprised how important exercise is. She's out getting sunshine. There's a lot of benefits to sunshine. You don't want to get sunburned, but there's a lot of benefits to sunshine. There is some, I'm not going to get into grounding and all that, but there are some potential benefits to that. But exercise and sunshine are much healthier than is widely recognized. Nature is actually really smart, and it helps us to get the most out of our environments. We're designed to get the most out of our environments if we live the way our ancestors did many years ago. Here's a big point on exercise. The body is like a seesaw. between whether it's in a high energy mode or it's a restoration phase. We'll call it a maintenance phase. So a high energy means after you've eaten a big meal, the body says, hey, we got all the resources we need. It's time to grow. And that activates this mTOR pathway. Again, it's like a contractor getting ready to build a building. It says all the building materials are available. Cells can now replicate. But you don't want that. If you have a cancer cell, you don't want it to replicate. You want to slow it down. If you can slow down cancer replication by 50%, you'll live twice as long. Slow it down more, you'll live even longer. And that's the goal. Slow down the replication of the cancer cells. Eating a big meal, that activates. Eating a big meal with lots of animal protein is a major activator of mTOR. Okay, we want to avoid that. All the fat drives up mTOR indirectly by causing insulin resistance, increasing insulin-like growth factor. These estrogenic chemicals stimulate growth of the breast cells. Pregnant women have high estrogenic levels. Also, estrogenic chemicals stimulate growth of the uterus and they stimulate growth of the prostate. The prostate is sort of the male embryological equivalent of the uterus. Excessive amount of sodium also makes things worse. Excessive amounts of iron makes things worse. Lack of sleep makes things worse because it elevates cortisol, which is a weight gain obesity hormone. So all of this pushes you in that direction you don't want. Whereas when you exercise, what happens is the body says, hey, I'm low on energy. I need to rest and sort of restore my cellular ATP levels. ATP, again, is the energy currency of the cell, like a $20 bill in a cell. So it activates something here called the AMP pathway. AMP means adenosine monophosphate compared to ATP, adenosine triphosphate. And so then it's called the adenosine monophosphate activated protein kinase pathway. All it means is the cell is like, hey, we cannot divide right now. I cannot grow. I'm so energy depleted. I just have to restore my ATP levels. I'm going to take it easy the rest of the day. And that's exactly what you want to do. You want to shut off mTOR. mTOR is grow and divide. Cancer progresses. AMPK pathway is say, hey, we need to restore our ATP. We just exercised today. Let's take it easy. No growth today. In addition, what also happens is when you're exercising, you're running around, all your muscles contract. Your arteries and veins are connected to your heart, but your muscles aren't, your lymphatic system is not connected to any pump system. So when you exercise, you get the lymphatic fluid to travel throughout your body. The lymphatic system is a parallel system. It's parallel to your arteries and veins, and it's used for removing cellular waste products. It's also used to remove anything that gets past the arterial lining, the capillary lining, the endothelial barrier. So the point I'm saying is when you exercise a lot, you really ramp up lymphatic flow. You can ramp it up 30-fold, and that lets your white blood cells surveil the body, find metastatic cancer cells, and remove them. Adequate sleep makes you healthier. Lowering your stress level for whatever helps you to do it. Those also lower your cortisol level. So these all put you into this rest and recovery health phase. And so you want to spend as much of your time as you can in the maintenance phase. You want to avoid this type of growth phase. Sunshine also increases sulfate in the endothelial glycocalyx, which is good for it. Sunshine also increases nitric oxide production. So nitric oxide is produced from your skin just by sunshine. So some sunshine is good for you, but you don't want to get sunburned, okay? That's a whole other topic. So get a little bit each day if you can, but don't get sunburned. Another thing exercise does is it keeps you smart. There's an animal called the sea squirt in its juvenile phase. It's like a tadpole. It swims around and has a brain. In its adult phase, it attaches to a rock, becomes a filter feeder, and its brain is reabsorbed. If you just sit around, you don't need a brain. Voltaire had said many years ago, why do animals have brains but plants do not? Because animals move. So what I'm trying to say is if you want to keep your smarts about you, exercising is the best thing you could do. You want to read too, have intelligent conversations, but exercise is real important. Okay, I'm kind of going through all the things that help a person to have optimal outcomes with cancer. Another one is spend time with friends and family, the people you love, because that makes you happier and it lowers your stress level. You might want to very strongly consider retiring from your job or reducing your work hours so you've got more time to rest, to recover, and to focus on healing, especially in the initial phase. You know, it depends on your individual situation, but you might want to do like a Family Medical Leave Act initially. So you got time to learn all this stuff and figure out how your approach is going to be, and then maybe go back to work part-time, or at least get this stuff figured out for yourself so you can optimize your approach to it. Okay, don't expect your doctor to do everything. You should do a lot to help yourself is the point I'm trying to make here. Some more stuff about what makes cancer worse. You got to watch out for excessive psychological stress. Not only does it increase the bridging molecule in the blood, I talked about that earlier, the fibrinogen sticking the red blood cells together, causing tissue hypoxia. It also causes activation of the platelets. And when platelets are activated in the blood, they become more prone to clot, more sticky. They will form groups around the metastasizing cancer cells in the blood. And once the cancer cell is coated with platelets, it will hide from the natural killer cells of the immune system, and they can't remove it. So what I'm saying is things that elevate the hormones of stress, which is cortisol and the catecholamines, like adrenaline, noradrenaline. Lack of sleep does the same thing, elevates the same hormones. Caffeine does the same hormones. That's why I don't think caffeine is a good idea. I know you've heard all these commercials saying, oh, coffee is good for you and tea is good for you. I don't agree with that, okay? I think anything that raises caffeine, I would avoid it. That would be my recommendation based on some extensive study of the subject. Okay, we talked about problems with sodium. Not only does sodium chloride cause a mild low-grade acidosis from the chloride, the sodium itself is a vasoconstrictor. It inhibits endothelial nitric oxide, so it decreases blood supply to the tissues, decreases tissue oxygenation, and it also causes some mild activation of platelets. You don't want that. High fat, especially after a saturated fat meal, which means especially animal fat, that also will cause increased activation of platelets. And all of these things can help to hide metastasizing cancer cells. Now we're going to talk again a little bit more about iron. When I was a kid, I thought iron was a good thing. You know, you want to be strong like Popeye, eat your spinach, try to get your iron up. I used to eat intentionally all these cereals like Raisin Bran because they were fortified with iron. The most you could get, I wanted that because I didn't know any better. But in reality, the body wants to minimize its iron, especially what's called the free iron. Here's an egg, for example. An egg, let's say from a chicken. It'll have an eggshell, but the eggshell is permeable to air and it's actually permeable to bacteria. Bacteria can get into the egg white. But the bacteria, they don't get to the yolk. And the reason is the egg white has no iron in it. And that's exactly the way your body handles bacteria as well. Imagine you were going to walk through the desert, okay? You had to walk 100 miles through the desert. You couldn't do it because there's no water. And that's why a bacteria normally gets into our blood perhaps, but it can't grow or do anything because we don't have any free iron for it to grow with. Just like a desert has no water for a person to walk through it. And the point I'm making, remember we talked about this just a little while ago, your cancer becomes like a bacteria, like an anaerobic bacteria. So just like you can prevent bacteria from growing by depriving them of iron, you can do the same thing in the human body. When you eat meat, in the center of hemoglobin, animals have heme, okay, hemoglobin, and that means they deliver oxygen with an iron in this molecule right here. So when you eat meat in the center of hemoglobin, you're going to be eating iron. So meat in general is quite high in iron. That's important to know. That's another reason not to eat meat. I once tried to review all the mechanisms by which meat causes increased risk of cancer. There was over 30 of them when I stopped counting. And T. Colin Campbell has said the same thing in his research. When he started trying to study it in his laboratory, he very quickly found 10 mechanisms, and he realized they're basically different types of pathway. Meat puts the pathway into this sort of anabolic overdrive for growth. It accelerates the rate of aging. You actually reach something called the Hayflick limit more quickly. Hayflick was a microbiologist working with human tissue cultures who found that when they divide more rapidly, they die sooner because they only get about 60 divisions in a non-germ cell, non-stem cell. So you don't want to do stuff that accelerates replication because it means it accelerates aging and it also accelerates cancer growth. In the center of the main molecule in plants, which is chlorophyll, you got magnesium, which is good. It's a vasodilator. Most people are deficient in magnesium because they don't eat enough plants. Okay, here's another picture of hemoglobin in animals, and there's that iron right in the center. And this heme iron is also different than the iron in plants because it's absorbed at a much higher rate. Typically in the ballpark of 50% is going to be absorbed, whereas plant iron is only going to be absorbed in the ballpark of 10%, and the body can regulate it more effectively. So what does that mean? What that means is when you eat meat, you'll tend to become iron overloaded. You know, women when they're postmenopausal, men after 20 years of age when they're no longer growing so rapidly. So here's the graph of that same thing. Men start becoming iron overloaded at 20 years of age. Women don't start becoming iron loaded after till they're postmenopausal in Western countries, because in the Western country they're typically eating high iron diets, and you want to keep your iron levels down. We'll talk about how to do that. Why is iron so dangerous? For a couple of reasons, but one of them is this right here called ferrous redox cycling. Ferrous means iron in Latin. Fe2 plus to Fe3 plus. Iron will cycle back and forth. It's a transitional metal, meaning it can have a variable valence, and it'll cycle back and forth between Fe2 plus, Fe3 plus. In the process of doing that, it donates electrons to other molecules in its vicinity, including oxygen, and it'll produce these free radicals like hydroxyl radicals, and that's like bouncing around a Super Bowl in a shop with glassware and porcelain, for example. It just breaks things. The reaction that causes this is called the Fenton reaction. You can remember this pretty easily. Fe for iron, Fe for the beginning of the word Fenton. And this is why the body does not want excessive amounts of iron. And this can become autocatalytic, meaning that it can just keep going and going and going. You don't want that. All right, so here it is in the human body. If you've got, you're going to leak a couple electrons normally under normal circumstances from the electron transport chain in the mitochondria. But if you start leaking excess electrons, because this is inhibited, for example, by high dietary fat, especially sat fat intake, saturated fat, and you've got free iron present, the free iron will simultaneously interact with the hydrogen peroxide that's produced, and you produce a lot more hydroxyl radicals. So that predisposes to cancer. This happens in the mitochondria. It happens in the blood. This will damage DNA in the mitochondria. It'll damage this entire membrane through what's called lipid peroxidation, and it'll shut down the mitochondria. So the main way to shut down a mitochondria is lack of oxygen, hypoxia, but you can also shut down mitochondria due to excessive free iron, undergoing oxidative stress reactions like the Fenton reaction, causing lipid peroxidation. So the point I'm saying is, either way, you're damaging your mitochondria and potentially initiating that cascade of cell transformation into becoming like an anaerobic bacteria and becoming cancer. That's why you don't want free iron in excessive amounts. Now, we don't have time to get into all this. There is something called the reverse Warburg effect. It's not as common, and we don't have time to go into the biochemistry of it, but here's the paper if you want to look into more on this. Michael Lasanti's paper, reverse Warburg effect. And the reason I show it to you was that the reverse Warburg effect enables cancer cells to feed on ketones. And because there's a lot of people going around on the internet saying, ketone diet, ketogenic diet is good. I don't think it's a good idea because of the reverse Warburg effect, because where are you going to get all that fat from? You're probably going to get it from animal foods or from oils, and they're all toxic to the human body. So I'm just letting you know, look up the reverse Warburg effect and the way the cancer feeds on ketones, okay? If you want to study that anymore. Now, here is the issue of estrogenic chemicals. Estrogenic chemicals, excessive estrogenic chemicals, they have all kinds of effects on a woman. Excessive amounts are associated with increased risk of breast cancer. Oh, by the way, I should talk about this. If you look at breast cancer in the upper outer quadrant, it used to be about 25% of breast cancer, let's say back in the 1920s. Now it's about 60% of breast cancer. So why the big increase in incidence? And I think the main reason is deodorant. If you're putting deodorant into your armpit, what are you putting in there? You're putting aluminum is the main thing that stops sweating. The lymphatics between the armpit and the breast are shared. And the aluminum is a metalloestrogen. It stimulates proliferation of breast ductal cells. In addition, the preservatives typically in deodorant and in most personal care products, they're going to be estrogenic, typically some version of a parabenzoic acid. They're usually called parabens, but there's lots of estrogenic preservatives. So you're rubbing two breast cell stimulators of growth into your armpit every day. And what do a lot of people do? They shave their armpit, okay? Other things that excessive levels of estrogenic chemicals in the body can do can cause proliferation of uterus cells, can cause endometriosis, can cause endometrial cancer, uterus cancer, can cause excessive bleeding, menstrual cycles, a whole bunch of things. We're not going to get into all that. Also, estrogen is a fat storage hormone. Estrogen levels go up a lot during pregnancy, and they tell the woman's body store more weight because the baby might need that for energy. So men that are overloaded in estrogenic chemicals, they have a tendency to become fat. They'll call it an apple shape, but it also looks like a pregnant female. And they'll get little man boobs, and it's not just fat. We call them moobs for man boobs. It's also gynecomastia, meaning proliferation of the breast ductal cells. And I have seen a few breast cancers in men. There's not that many, but I've seen a couple of men die from it. It does happen. Oh, this is one thing is people say, it's so hard to become a vegan. It's so hard to learn nutrition. No, it's not, okay? The reason it's hard is because you have to unlearn all the stuff you've been taught in the past that's incorrect. And it's actually going to be pretty simple. Just open your mouth and look in the mirror. Your teeth are flat like a horse, like other herbivores. Your jaw can go side to side. That's for grinding plants, okay? We've got herbivore physiology. We've got a long intestinal tract, okay? We got amylase in our saliva, all right? It's real simple. Just eat starches, fruits, and veggies. Some people even say primarily eat raw food. You don't have to eat just raw, but that would be just fruits and veggies. Some people like that for the convenience of it. But that's pretty simple. Just eat 3 things. You'll have to eventually take a B12, vitamin B12. That's simple, okay? What other things happen? What most major university medical centers, in my experience, recommend is some version of the Mediterranean diet. The Mediterranean diet doesn't work. It's bogus. It's the illusion of dietary therapy. The reason is it doesn't really exclude anything. Mediterranean diet allows meat, allows chicken, allows fish, allows alcohol, allows oils. It's a bad idea. It's like the illusion of treatment, and people think, diet attempts failed. No. The Esselstyn diet, McDougall diet, low-fat vegan, I call my version of it the Spartan Vegan. It's really all pretty much the same thing. And what ends up happening, they go, oh, diet didn't work. And then they end up just taking pills and having surgeries for all these chronic diseases. The reason these diseases like hypertension are called chronic is because you cannot cure them with a pill. They're a dietary disease. You need to fix the diet if you want to have any chance whatsoever of curing them. And it depends how soon dietary change is initiated. If it's initiated early, there hasn't been much damage to the arterial wall, and you got a very good chance to reverse it. But if it's been going on for decades, you might never reverse it. So a person who has to take all these pills, they get milked by the system, if you will, like a chump. That's why I wrote chump on the side of this cow here. You want to learn about nutrition and these simple things for health so you can try to fix your own problems if it's possible. I mean, it might not be possible for you, but for most people it is. A lot of Pritikin, for example, said he would get 90% of his patients off their hypertension meds. So it depends. So basically, you want to choose your path in life. This is a Tarahumara. They live in northern Mexico. They eat a low-fat diet, not 100% vegan, but close to it. And they're world-famous ultramarathoners. Ruth Heydrich had went and visited them. Other, famous athlete runners had visited them as well. I read the papers on them, like by Bill O'Connor. I think it was 1978. And the point was they had a total cholesterol somewhere like around 130. They have a holiday where they run over 100 miles in 2 days. Whereas if you look at the typical Westerner, there was a Pima population also from that same northern Mexico area that was absorbed in the United States after the 1848 Mexican-American War. And they now eat the SAD diet, standard American diet. And they're some of the most unhealthiest people in the world with tons of obesity. And they get all the standard surgeries of people on the westernized diet, open heart surgery, CABG, coronary artery bypass graft, gallbladder surgery, et cetera. They end up with amputations from diabetes. This is a much better way to go through life. And it depends on diet. Okay, and then what does it all come down to? If you eat a standard American diet with a lot of saturated fat, for example, you've got a high risk of heart attack, myocardial infarction, a high risk of cancer. And then if you look at some of these other populations, for example, this would be the Japanese diet, which used to be lots of rice, but they had very high sodium, and that was associated with them having hypertension. They also smoke lots of cigarettes. That contributes to hypertension as well. South Asians, like the Indians, I think that what gets them into trouble is they eat too much fried foods. They have a very high incidence of diabetes. But the point of this slide is look down here at the low-fat, low-sodium vegans. They got low risk of all this stuff. They're low risk of diabetes, hypertension, MI, stroke, impotence, and they have a much lower risk of cancer. It's obvious. It's like winning the jackpot at the slots in Las Vegas. It's an advantage in every way. I'm not aware of a disadvantage. You got to take B12. Whoop-de-doo. Okay, that's a pretty minor thing. Here's what I call my Spartan Vegan pyramid of health. And it's simple. There's only 3 things to know. Eat starches, fruits, and veggies. And then you'll end up needing to take B12. That's pretty simple. That's pretty much the summary there. The poor man's guide to fight cancer, incrementalism. Hope that was helpful.
Wow. Dr. Peter Rogers, that was an amazing talk. Thank you so much for sharing so much of your day with us, Dr. Rogers.
Oh, thank you for inviting me. It was fun. It was my pleasure.
Aloha and mahalo. Have a great day, everybody.